Hello, my name is McLaughlin, and this is my presentation on non-Hodgkin's lymphoma, current and future treatment. According to the National Library of Medicine, lymphoma is a cancer of the lymphatic system, which is part of the human immune system. There are several types of lymphoma. The focus of this presentation will be on non-Hodgkin's lymphoma. I will be discussing some background of this type of cancer, as well as new, groundbreaking treatments. Non-Hodgkin's lymphoma is a cancer of the lymphatic system. The lymphatic system runs throughout the body. Common areas where we can feel lymph nodes are in the neck and armpits. Lymph usually work to our advantage, producing lymphocytes. These work to keep our bodies healthy. They attack foreign bacteria and work as a part of our immune system. When non-Hodgkin's lymphoma occurs, it means that cells in the lymphatic system have mutated into cancer. This often occurs in the B cells, but can also affect the T cells. Because the lymphatic system is a whole body, interconnected system, lymphoma is in many cases able to metastasize to almost anywhere in the body, including bone marrow. Please click on the link above if you want more information about the lymphatic system. This slide depicts some basic demographic information which may help put into perspective the impact that lymphoma has on our society. There are more than 30 different subtypes of lymphoma. 70,000 people in the United States are diagnosed with lymphoma every year. 85% of the people diagnosed have B-cell lymphoma, making B-cell lymphoma the most common type in the United States. Some common symptoms that a patient may experience include swelling of the lymph nodes, fever and night sweats, coughing, trouble breathing, weakness, weight loss, abdominal pain, and swelling. Lymphoma is staged similar to many other types of cancers. In stage 1, the patient's lymphoma may be found in one region. Patients in stage 2, it may be found in a neighboring region or a separate area. Patients who are in stage 3, it may be found on both sides of the body in one region, or it may metastasize to an organ. In stage 4, it may spread throughout the body. This includes spreading to bone marrow, organs, and the brain. Prognosis for lymphoma patients can vary dramatically. One of the most aggressive forms is known as VLCCL. Although this form can be very treatable, it can also be deadly. If it is found in a late stage, or if the patient is not treated, the patient may die within several weeks. Beyond surviving treatment, the patient must also consider the possibility of relapse. According to Caltera and Dahlia, the 5-year survival rate for this type of cancer is between 30 and 50%. In the past, there have been several treatment options for patients with cancer. Options include things such as chemotherapy and radiation. However, in many cases, these options come with devastating side effects. Immunotherapy is a somewhat newer treatment option. Immunotherapy attempts to activate the body's own natural immune response to fight off cancer cells. The specific therapy used for non-Hodgkin's lymphoma is monoclonal antibodies, which attack B cells. These antibodies are lab-produced to attack the protein CD20 and kill B cells. A patient undergoing this type of therapy would have the lab-produced antibodies injected into their body in hopes that the antibodies will then attack the B cells and attack them. This attack triggers a response from the body's own natural immune system, which in turn attacks B cells. This is important because in many cases, cancer is not seen by the body as a threat, although it is very harmful. This is why our immune system does not respond to cancer cells. By using immunotherapy, we may be able to solve this problem. Monoclonal antibodies are in use today for several types of cancer. For example, Avastin, which we recently read about, is a monoclonal antibody. We read about Avastin in regards to breast cancer. However, it is in use for many types of cancer. Rituximab is a monoclonal antibody specifically used for non-Hodgkin's lymphoma. In a 2012 study, researchers Caltera and Dahlia tested rituximab on DLBCL patients. Patients ranged from ages 18 to 60, and their stages of cancer ranged from stage 2 to stage 4. Researchers found not only increased survival rates, but also that patients had lower toxic reactions to medication. Originally, monoclonal antibodies were designed to target aggressive or late-stage cancers, as well as relapse cancers. However, rituximab is being expanded to be considered as an initial treatment option. This is important because many initial treatment options, such as chemotherapy and radiation, have devastating side effects. Although rituximab does have side effects, they are not considered as severe. Some common side effects include nausea, fever, fatigue, and rashes. According to the National Cancer Institute, there are currently several hundred clinical trials underway for rituximab, and many people awaiting and hoping to get into these trials to help not only defeat their cancer, but improve their quality of life. I believe that improving the quality of life of cancer patients is just as important as extending life and defeating the cancer. I think that this is one of the reasons that why immunotherapy is such an important advancement in current research. Many people that I know who have undergone chemotherapy and radiation commonly state that the treatment is worse than the disease. I think that this is a big problem in treating cancer patients. Non-Hodgkin's lymphoma affects people all over the world. New advancements in treatment are continuing to help improve the quality of life for cancer patients all over, as well as extending survival rates. This research is leading us in a positive direction for all patients. I believe that the ultimate goal is to eliminate these disorders and diseases for a better quality of life. But until that time, I believe that the new treatment options are a step in the right direction. Thank you.